Okay, welcome everyone. So I'm Sangeeta, okay, from Emerging Journey Asia. Have you can see some of my videos. So Gurmit, this is my tagline, yeah.
Okay.
So I'm Sangeeta from Emerging Journey Asia, your mental health advocate. So
Lovely.
this is what I always do at the beginning of my session, and at the end, I'll end it with reach out, speak out. Okay.
Yep.
Okay, just to share about our guest today, Dr. Gurmit. Okay, Dr. Gurmit is the clinical teaching fellow at UCL, okay, University of Southampton, UK, and it's 7 o'clock in the morning there. So
Uh,
we just gonna go, and if you have any question, just text because his time is limited. He need to go and work. All right, and he is also a specialist psychotherapist at IAPT. Okay, so Gurmit, introduce yourself more, because if myself, I'm a person who just straight to the point and tell what it is, and because we are not in a session right now. So yes, please share more about what you do and how's UK right now, how NHS is working, IAPT is working. All right.
Aku tak konkret dia now dekat sudut bawah belah
yep.
kanan dia
I think I can hear
Yeah,
someone
I
talking.
mute. Yes, I muted them.
Yeah.
Okay.
Okay, thank you. Right. Hello everyone. Selamat petang sana. Ini selamat pagi here, I think.
Tengah hari,
So
tengah
you
hari.
tengah hari, yeah. So you probably know, I'm Gurmit. I'm a Malaysian, by the way. So and I lived in Malaysia for 20 years of my life before I came to the UK, about more than 20 years ago now. So so I'm a psychology graduate from University of Malaya, and then I came here to the UK. My sister was here before me, so it wasn't really difficult to come here. So and I pursued my studies here. So in psychology. And lots of therapeutic modalities. So since then, I've done a few degrees and worked with the government here. I work for the National Health Service, which is you probably see in your newspapers and media, NHS in short.
Yes, you're very famous here, NHS.
Yeah, NHS is very fair. So I've been working here. So in my department, it's called IAPT, which stands for Increasing Access to Psychological Therapy. That's what it stands for. So basically, it's a government initiative that gives the mental health services for common disorders, mental health disorders, as anxiety, any anxiety disorders, OCD, generalized anxiety disorders, and so on. And then you get depression and so on. So all these general mental health conditions we treat. So the government is at the back of it, sponsoring the whole project. We've been doing this for the last 10 years, and this is a very good time to test mental health services as well as the physical health services. That's what I do. In terms of teaching, I do a little bit of teaching. I did all my degrees in Southampton universities. My master's and my PhD and so on. Currently, I'm teaching in UCL, which is University College of London. You must have heard of UCL, which is part of University of London. And I teach there once a week, teaching similar cognitive behavior therapy courses to postgraduates, as well as supervising them on the clinical cases. So that's what I do. And if you have any more questions, please ask me as we go on.
Okay, thanks, Gurmit. Thanks. Okay, first, how's the condition there in the UK when we talk about with this crisis right now?
So in the UK, we've got more than the government confirmed yesterday. We had more than 21,600 deaths. Unfortunately, wow. It's gone quite high. So we are one of the top in Europe. And basically, what's happening is the deaths have been caused by severe cases, and the target group which are dying, unfortunately, is more people who are above 70 years old. So it's the older population that is dying. I mean, naturally, they're not dying of natural diseases. I think they're dying of normally the COVID. And we also now have people dying in care homes. I think care homes, I don't know, in Malaysia you call them rumah orang tua, I think.
Yeah, aged care we call it.
Yeah.
Aged care,
so
yeah.
That's it. Yeah. So lots of people are. I mean, naturally, we know that above 70, your immune system and so on is not very strong. coupled with conditions such as diabetes, hypertension, COPD, heart conditions, cardiac conditions. I think all these makes the person weaker, basically. And then what happens is if you have any breathing condition, lung infection, so on, that makes it more difficult. And what happens, your defense mechanism is not able to fight off the virus. And lots of people are dying in care homes. And at the moment, I think it's about 500 per day who's dying in care homes, unfortunately, because of this condition and their age and so on. So so the government is, I think, trying their best to focus on getting people well, and I think we are doing so quite well at the moment. I think the death rate is quite high, but we are doing well in terms of people are now. Some people are recovering. The government's getting everyone key workers. So what we call everyone working in NHS who are at the front line. They call it key workers.
Okay.
So the key workers are now being given a test to test yourself whether you have the virus or not. That's part of the government strategy.
All right. As for here in Malaysia, it's like, we still have our social distancing. You need to maintain your hygiene, and they only lifted a few industry that they need to go back. But again, after some time, it can bring a very big toll to that individual well-being, especially like for myself. The first 2 weeks is like, okay, adapting to a new thing. Someone with my personality who always go out and getting things done. So to change it's not easy. There's a lot of negative self-talk, a lot of emotion, a lot of things that is running in the mind. And I'm sure a lot of them go through the same thing, right? Because the routine is we are out, we are not in. And we know once you are out, you are committed with your job or whatever that you're doing. And then once you're back, you know your roles and responsibility, All right. So a little bit that I would like you to share is that, okay, I would like you to share about what is trauma, because we look at trauma differently. Some of them look at it like, okay, it doesn't affect them. It doesn't, there's no impact. So can you share about your take on trauma?
So trauma, I mean, generally speaking, the guidelines of trauma normally falls under post-traumatic stress disorder. There are two types of trauma. So basically, the first one is physical trauma. Physical trauma is what people are going on now, right? You have road traffic accidents, your body, let's say, gets a big impact from the steering wheel. So the front part of your body, where the airbags of the car get activated during the accident. So nevertheless, you will still have lots of injuries to the front here. So that becomes a physical trauma because the pain on the muscles and so on. So then you also have psychological trauma. Psychological trauma is about what happens during that time. It's not just physical, but it's also the way we look at it. You perceive that incident. So that becomes more of a psychological. When we talk about psychological, we're going into the root of post-traumatic stress disorder, because that's what normally happens. But naturally, I think for someone to have post-traumatic stress disorder, it has to be diagnosed. So, so post-traumatic stress disorder basically it develops following a stressful event or a situation of an exceptionally threatening or catastrophic nature, which is likely to cause pervasive distress in almost anyone. Okay, PTSD does not therefore develop following upsetting situations that are described, as our everyday traumatic language. For example, divorce. I forgot to go on my bus today. Oh God, I didn't go for my exams today. That's not post-traumatic stress disorder, even though it's quite an upsetting situation. Some of them, PTSD disorder can affect more people of all ages. It's around 25-30% of people experience a traumatic event may go on to develop post-traumatic stress disorder. So before the disorder, it's only post-traumatic stress symptoms.
Yeah.
So that's generally speaking that's post-traumatic stress.
Okay. Yeah. Thanks for sharing, because most of the time, like what you mentioned, right? People when people go through divorce or certain scenario, they always say, "I feel trauma." I feel that I'm going into crisis. I'm going into so many things that they are unable to express their emotion. They are unable to and again, I would like to relate this with stress because
Mm.
it's overused word,
Mm-hmm.
right?
Yeah.
Yeah. So that is why it's good that you clarify and share with everyone that not everything is trauma, not everything is traumatic or a crisis. Yeah.
Mm-hmm.
So I also would like to ask you, what's the perception of individual when they talk about trauma and when they talk about crisis?
So perceptions of individual, I think generally it differs on your background, some of them, and the way you've been taught about things in life.
Mm-hmm.
So, for example, and it could be medically informed if your background is a bit medical,
Mm-hmm.
or psychologically informed, or it could be culturally informed. So let's go to the culturally informed first. So
Yes,
so
that will be
we
good.
have, yeah, so we all have different cultures in where we come from, where we head from. So in Malaysia, I know from as far as my memory goes, we got multicultural society over there. We got the Chinese, we got the Indian, Malays, and so on,
Mm-hmm.
and the Sikhs. Um, so we all have different way of looking at trauma. So for example, the Indian or the Punjabi, for example, background might perceive it differently. So for example, I remember my dad used to say, if you've fallen something, just get up and go.
Mm.
And for them, trauma was there was the point of mental health problem never existed because they were hard workers. They're the first generation of people who came from India, for example, and then
Mm.
for them, trauma did not take place as much. It was more about a little bit of anxiety, which wasn't recognized as anxiety, but it was just recognized as, oh, you have fallen. Just
Mm-hmm.
get up and go again. So it was lots of emphasis on physical health more than the mental health.
Mm.
So that was the cultural understanding, and some cultural understanding might see trauma as a supernatural powers. So,
Mm.
so for example, someone is doing bad on you. So we have a lot of evidence on this, black magic and so on. I'm sure
Mm-hmm.
that this term is not alien to any one of you who are in Malaysia. Black magic, supernatural powers. Someone's trying to do something bad on you. For
Mm-hmm.
example, if you have a road traffic accident, and you have a neighbor who doesn't like your family,
Mm-hmm.
now that they may say, oh God, this is I know that they've done something to you. They normally go to that BOMO, right?
Yes,
Is that a
yes.
familiar
That's
term?
that's that's where they go to before they seek proper
Yeah.
treatment.
Medical help.
Yep. Yep.
Correct.
Mm-hmm.
Correct. So there we are. And there's no different here. So we have black community over here. So black African, black Caribbean. A few number of years ago, my colleague, he did his PhD on some work on recognizing cultural work, and he found the same. Their pathways. I mean, I've got a slide of it, but that's a very long slide.
Mm-hmm.
I did some work with the university students. So it's the same. So basically, the slide suggests that the pathway, they go to healers. We call it healers here.
Mm-hmm.
So they go to healers first, and the understanding to trauma will be someone's done bad to you through supernatural powers or black magic, and their understanding is that that's why you have this trauma. And the trauma, sometimes if you are having some mental health issues, they will just label you, for example,
Mm-hmm.
saying in their own language. I can't remember the black Afro-Caribbean used language, but in Hindi or the Pakistani community here, they will use pagal, for Punjabis and English,
Crazy.
yeah, crazy. So
Crazy.
they will use, this guy is going crazy. So and crazy because of the trauma, not crazy otherwise. So basically, he's trying to get rid of this person so that he can't have a good life in life. So that's what their understanding of that. So that's very much culturally informed
Mm-hmm.
understanding of trauma. And in other words, or the other understanding of trauma, medically, if you're medically informed, I mean, naturally, you are going to be very much evidence based.
Mm-hmm.
And understanding from what's evidence based in of trauma. So, for example, I gave you an example early on. people with medical knowledge will know that what is a psychological trauma and what's a physical trauma. So they are much more keen and much more likely to seek help from the evidence-based treatments. So, for example, medication. Any medics over here, you probably understand that this is what they would probably looking for. Any medication, mental medication, antidepressants, anti-anxiolytic drugs, and so on. So they will go on that route. So anyone who is not like layman, someone's done an IT degree and so on, and if you have a family who are very much, for example, into cultural, very strong in religion, understanding, I think that sometimes can influence your decision. So, for example, your parents might override your decision that you don't have to go to hospital as first line of treatment. Go to come with me. Let me take you to this healer.
Yeah.
Let's see what the healer says. Let's see what the imam says. And also they did some studies here with the Muslim community. Malays, I think we have in Malaysia, and Muslim community here. I think they come a lot from Pakistan, Afghanistan, and Bangladesh Muslims. They have lots of their first line of seeking treatment pathway would be going to the imam in the mosque. And there's done research recently done that not a loss of imam in the mosque would then move them on to go and seek medical help. The imam itself will be trying their best to heal them with, I think with the Al Quran verses. So trying to get them better with that, but I mean, not all of them get better with that. I think that falls down to the person's belief. Is this how much do you believe in Al Quran? Do you do all your deeds of praying every day, 5 times a day, and so on? So that's what I think generally speaking, these are different underpinnings of trauma perception that all people have.
Yeah, just to add on to that, Gurmit, even here when I give my talks or in my workshop, I always tell, I share with my participant, do not use religion. Do not use religion and make the person who has been going through these mental health challenges and feel that they are even worthless. They feel that they are not worth it. They can't do things. They are a lesser person. So I say that use religion to guide them, not to tell you are not doing this, therefore you are like this. You got this. It's like a sin for. They get punishment for their guilt or their sin. Yeah. So to everyone, please again, do not use religion, but guide towards that recovery journey. Yeah. Okay, Gurmit, let's share a little bit more about coping mechanism. How do people cope in terms of crisis? I mean, we see a lot, in everywhere, right? Even I myself, we talk about deep breathing, we talk about mindfulness, we talk about muscle exercise and all that, right? Is there anything else that you think will help or will assist individual in time of crisis?
Yeah, thank you. I think I think that I think one of the first things you need to understand is that coping mechanism. People have different types of coping mechanism that works for people. Now we need to understand that coping mechanism can be divided into something that works for you, something that works for you but it's not good for you. So the good example would be something that works for you could be cigarettes, like everyday smoking. So cigarettes, we know in the longer run it causes a lot of lung problems. Yeah, so, but that itself is a coping mechanism for someone because they just love doing it. They've been doing it for a number of years. That relaxes them. Some people do, drugs, weed, and so on. That relaxes them. We know that weed, for example, might have some relaxing additives in the drug itself, but in the longer term, we know that it causes a lot of problems. So that's something generally people need to recognize. What are your coping mechanisms per se? Now, can I just share a slide?
Yes.
I might be able to.
Wait, let me make you a host. So I'm going to transfer the host to you. Yeah. So now, now you'll be able to share your slides. Yeah.
Thank you. So let me just check what have I got here. Slides.
So while waiting for Dr. Gurmit, any one of you have any questions, right? If you don't want to share publicly to everyone, you can private message to either one of us. We will address to your concerns, yeah?
Yeah.
So how's everyone? So far, so good? That's the reaction.
Okay, can you see the slides?
Yes, Gurmit, thank you.
Okay, so there you are. So basically people need to know, I mean, this is just a symptom chart, you know, to let you know that there are different, how to differentiate between COVID-19, cold and flu. Some people sometimes have a very mixed understanding of it. But generally speaking, I think it's important that people need to know what is coronavirus, what is, there's common symptoms, they overlap each other. I think people need sort of need to know that if you are having it, um, that could be cold, it could be a flu, it could be anything. It could be something due to the haze that Malaysia might have, you know, lots of smoke in the air. But I know that that's all clearing up because there's not a lot of cars now.
Yeah.
But I think it's
Gurmit,
very,
can you put it
yeah.
into presentation mode?
Is it not in presentation mode?
No.
Hang on. Okay, yeah, yeah.
Okay.
Yeah, so people need to understand that these are things that will also inform the way you cope. Because if you know to differentiate things, your symptoms in the first place, you will understand that, you know, the symptoms you're having may not be coronavirus, may not be that. But sometimes I think the important ones are the major ones: the fever, the cough. Okay, and if you look, even the flu will also have cough. You see that common, usually dry cough, which is very similar to coronavirus. This is why they have picked up lots of similarities between both of them. So just be mindful of that. I think it might be very useful. Now let me just move on to the slide. Next slide, guys. Okay, can people see this?
Yes, I can.
Yeah. Okay. Yeah. So again, the difference between physical and mental health, I
Okay.
think, is very symptoms important. You need to recognize the differences and what they normally cause. Okay. So let's move on to coping. So what can I do to cope with my worry? Naturally, people need to understand. Um, so the easiest way is to always try to understand what is this causing you, basically. So if you look at what's going on here, so the thoughts, for example, so we need to think about the trigger. So the trigger could be TV, right? You see TV every day, every media, news, newspaper, everyone's got 99% that's COVID everywhere. So that COVID, if you have the trigger of the COVID, for example, that you know, automatically brings about a thought in your mind that I might die. You know, no one's going to survive. So that thought is an anxiety related thought. It's not going to be, you know, giving you some happy emotions. So naturally that feeds into feelings. Can you see my cursor moving?
Yes.
Yeah.
Yes.
Yeah.
I think
Okay.
you still need to press the presentation slide because this is still the edit mode.
Hang on.
Right. To the bottom right.
Oh yeah, I can see that. Yeah.
Yeah. Yeah, that one.
Okay.
Okay, thanks.
Okay. Is that better?
Yes, so much better. Thank you.
Okay. So the feelings. So the feelings is uncertainty and worries. So that's why it falls in here. Oops, sorry, I've gone back too much forward again. Okay, yeah. So the feelings is very important. When you acknowledge the feelings, and this is quite a common feeling. I mean, everyone and anyone who's been through these kind of situations in life will have this sort of feelings. You know, fear, worry, and so on. But what happens is, I mean, you can talk. Almost everyone, 28 people on this slide today will have similar sort of feeling. So when you have this feeling, naturally that you know makes you people feel have more physical symptoms. So for example, you might have chest tightness, pain, feel a little bit feverish, not necessarily have fever, but feverish, and muscle aches and so on. So that then contributes you to feel a little bit more anxious because the tightness is there. What happens? Normally people start checking. So you know, if you have a little bit of checking, that checking habit becomes more and more, you repeat it. If you've done twice today, you might be doing 10 times one day. So that 10 times one day becomes a habit. So the habit then comes into this little cycle here. See what's
Mm-hmm.
going on here?
Mm-hmm.
So this cycle here becomes unhelpful. We call it a vicious cycle, a vicious cycle of worrying. Oh my God, something is going to happen to me, and so on. I think it's important to recognize this first of all, because everyone, almost certainly everyone will have this trigger, will most likely to have these kind of thoughts, that no one's going to survive, I'm going to die, what about my family, and so on. And naturally that contributes to these feelings, so people need to understand that. So moving on, so what can I do to cope with my worry? There are a number of things that you need to know. Now I'm going to miss the dreadful situation over here because that is more to PTSD related, and
Mm-hmm.
I want to move on to the thinking, behavioral strategies, and other strategies.
Okay.
So this is the dreadful. You need to understand, how it works. This is more if you do psychoeducation on the role of amygdala and the role of hippocampus.
Yeah.
So thinking strategies. So first of all, you need to recognize your negative automatic thoughts. I think they're very important, and try not to stop them, because if you take 1,000 people and go and ask them today, what do you start feeling and thinking whenever you see news? Our prime minister, who's prime minister now? Is it Muhyiddin? Is that correct?
Yes, yes,
Is it Muhyiddin? Is it? Yeah,
yes.
Dato Sri Muhyiddin, right? Okay, is it your Tan Sri, right?
Answering.
Right, Tan Sri Muhyiddin, isn't it? Yeah. So whenever he comes on TV and give you some news about his other ministers, automatically your mind will take you to start having, oh my God, things are getting worse. What's going to happen? So on. I think if you take 1,000, even you can ask half of Malaysians' population, what are your thoughts on that? Almost everyone will tell you we are having these thoughts, worrying feelings and thoughts. So you can't, no one, and ask them, can you stop them? They will probably say no, we can't stop them because it's automatic. So you
Mm.
need to recognize the nature of the thoughts. They're automatic. You can't stop them. Would you, it's like cross, if there's a big river with a very strong stream
Mm-hmm.
and you want to cross the other side, think about how would you cross? Would you be able to stop the river? There you are.
Impossible.
Yeah, so no one can stop the river, we know that, right? Unless
Mm-hmm.
you have super magic powers, but I don't think so. I have no anyone to have that. So you're not going to be able to stop the river. So you got to think about strategies. How can I cross the other side without stopping the river? So
Yeah.
the nature of the thoughts is similar to the river. You cannot stop them, but you got to think about, can I cross the other side without stopping them? Yes. Okay. So you need to understand that's the nature of the thoughts. Okay,
Mm-hmm.
okay, it's going to come and it's going to go. You don't have to always attend to it. Number one. Number two, being aware of some of these thoughts and feelings as mental events, they rather than facts. These are not facts.
Mm.
Okay, they are mental events. In other words, your thought processes that goes through your mind.
Mm-hmm.
It's not a fact that you're going to die tomorrow. How do you know that? Do you know that you're going to have the symptoms? No. Have you get it checked out? No. This is why the government is saying we need everyone to get checked out. Even us here in the UK,
Mm-hmm.
even just with the key workers, we not all key workers haven't got checked out. I can't get checked. I'm trying to get at 7 o'clock in the morning, for example, going on the internet to get myself to order a home kit. The government will send a home kit for me to check out with my saliva.
Uh-huh.
That's not happening because all the kits run out. So I need to drive to a nearest center here to where the army is probably sitting with the kit and then get it checked out. I haven't got time because I'm busy with my work. You see,
Mm-hmm.
so this is very important for me to understand, that these are just thoughts. And that the fact that I think I have coronavirus because I may have a bit of chest tightness, a bit of shortness of breath, but that is not. I don't know for 100% I have that. So, but my thought tells me I may have it. I'm anxious. So again, these are more sort of anxiety related thoughts processes. These are not facts until it's proven that you have it. To be honest with you, I wouldn't be sitting here talking to you if I had COVID. Okay, so that's one thing. So the other thing is normalizing. Share
Mm-hmm.
your thoughts and feeling with your friends. Okay, everyone is having this anxiety. Almost everyone is feeling so anxious in the whole world.
Yeah.
They are not sitting down, they're all talking about it. Okay, and going out and worrying, thinking about it, but they're also sharing, because the more you share, the more it normalizes. If you look at a normalized curve, You know, with everything in life. You know, when someone dies, what happens in our culture? When someone dies, you know, everyone will come and talk to the mother or the
Yeah.
father. All the men will go to the men. All the women will go to the women.
Mm-hmm.
Why do you think they do that? It's
Mm-hmm.
a similar principle. It's normalizing, because when they talk, they feel better. When they talk about what happened, you know, you're actually sharing that concern, the
Mm-hmm.
feelings, and that's why it feels better. That is a very typical and the best way of sharing, you know, taking off from your shoulder. And that's been happening in our culture, Indian culture, Punjabi culture, Malay culture, for a number of decades.
Mm-hmm.
And it's actually a normalizing exercise if you think about it. Right, moving on. Gratitude journal, 5 things that went well. Always try your best to write a gratitude journal. What's the 5 things that's gone good in my life today? Yeah.
Mm-hmm.
So that sometimes help. Your concentration is very important. What are you concentrating on? If I concentrate on COVID related problems, naturally no one's gonna feel happy, are they? If you concentrate, I mean, naturally, you can't distract. You can distract yourself with that, if you, as much as you can. But if you concentrate on activities that's going well in your life, that will be helpful. The last one is on thinking strategies: worry versus hypothetical versus real worry. Worry is a very common thing. We all have it as in humans. I will be more worried if someone tells me I'm not worrying. Yeah.
Yeah.
So it's a very common thing. But what's important is hypothetical versus real worry.
Mm-hmm.
Okay.
Mm-hmm.
So so moving on to my next slide. So practical worries is what you actually worry in every day. You know, like you know, I need to go and put petrol today. How am I going to get out? So that's a practical worry. Okay, that's a real worry. You know, um, and hypothetical worry is more about future case, anticipatory anxiety. What you're not sure about. You think like COVID is going to wipe off my family. It's a hypothetical worry. You don't know that. That is, you know, if no one in the family have died, then that might not be true. But if someone's family have died, there is some truth to it. So then you have the right to worry more than others. So, but I think hypothetical worry is more about your anxiety is very anticipatory in nature. You don't know if something's going to happen. We are worrying about it. Normally, people who are, you know, people have personality as worriers. They have this sort of hypothetical worry. You know, I'm sure lots of people have you have come across in your life who are natural worriers. They're
Yeah.
always worried. Yeah.
Always
So
worry.
they
Yes.
correct. So they are the one. These are the group that will have that kind of condition. But again, you need to think about: is this real worry or is
Mm-hmm.
this hypothetical worry?
All
There's a
right.
tree here. I've just given here just to give you a little bit of example. We call it the worry tree. I mean, I think some of you may have seen it. Some of you may have not seen it. I don't know.
Mm-hmm.
So notice the worry, for example. It's a little pathway. So practical worry is the real worries. Hypothetical worry is the hypothetical. So notice the worry. What am I worrying about? For example, is this worry current or is it a hypothetical situation? Or can I do something about it? So the question would be then, if you can do something about it, yes, then becomes practical worry. If you can do something about it, that is the current problem. And then you have an action plan. And what, when, and how. You can then postpone it to do it later. You schedule it, let the worry go, and change focus of attention. So that's one way of dealing with it. The other way of dealing with it, if you want to do it right now, which you also absolutely can, you
Mm-hmm.
do it right now. Let the worry go. So change the focus of attention. The both of these at the end here is the changing your focus of attention.
Mm-hmm.
Yeah, that's very important. So
Yeah.
that's the other thing. So if hypothetical worry, on the other hand, when you have it is a worry about a current problem, let's say COVID. Hypothetical situation is if it's hypothetical, then no. Okay, you
Mm-hmm.
let the worry go because you don't know the answer to it. One thing people need to understand, I said earlier on, um, mind is automatic. It's always in automatic mode. The nature of mind, it will always be in automatic. We cannot stop the mind going in, the thoughts that are running in and out of our mind. So if you know and understand this, you don't always have to go and latch on to every single negative thoughts that you are experiencing in your mind right now, for example.
Yeah.
Because let's say if one thought, negative thought, will have times 40,
Mm-hmm.
because of that 40 represents all other different situations that worry is attached to. Let's say debt, you know, utang money, is that correct? hutang, debt.
Hutang, debt. Yeah,
Yeah,
hutang.
yeah, hutang. Okay, if you're worrying about that, for example, you know that that person has given you 6 months to settle that worry, or the bank has given you 6 months to settle that
Yes,
worry.
yes.
But you're worrying that worry 6 months. You're worrying about it now.
Mm,
You have 6 months to settle that worry, but you are not satisfied, are you? You are thinking about it now, and that nowness of thinking causes you stress.
mm,
But what you're not focusing on is here, the practical worries. I have 6 months. I can do something about it later, schedule it, let the worry go. But what are you worrying about it here? You can't let it go because you're thinking about it, how I'm going to achieve to go up to the 6 months. You
yeah.
see that? So you're not letting it go, you're engaging it. So when you engage in it, you find it very difficult to change the focus of attention. So that then becomes a major problem here.
Yeah.
Um, what you can't really solve, but it's happening. Okay, let's move on. Um, so behavioral strategies. Now, behavioral strategies are things like you can do now behaviorally. Okay, uh, what do you call behavior in Malay? I can't remember now.
I think it's perilaku.
Perilaku. That's it.
It's
Good one.
perilaku,
Thank
yeah.
you. Perilaku. So perilaku is very important. Okay, the way you handle things behaviorally.
Mm-hmm.
So this is the, I'm sure that, go back, rewind yourself 3 months ago in January, or even 1 year ago from now. I'm sure some of you may have talked about, oh, I don't want to go to work. Why can't I work from home?
There's a lot of them.
Yeah,
And they feel it's the best work-life balance, you know?
that's right. Yeah, I'm sure lots of them have talked about this. Yeah, because
Yes.
of many reasons. Many reasons. Some of you with families,
Yeah.
that's absolutely, you want to take kids to school,
Mm-hmm.
other commitments in life.
Yeah.
Now, because that at that time didn't allow you to spend time with your family, I'm talking about quality time over here.
Yes.
Now, this is the best opportunity for you to now um, dominate on this given opportunity. The government has given you opportunity to work from home because you can now do that. Isn't this not the good time to spend your time with your family and the loved ones, doing the joint activities that you always enjoy doing with them or yourself?
Mm-hmm.
So because you're not going to get this again. The government is going to take this away from you very soon, and
Yes.
you're back to work again. So those of you have any things that you need to think about with your family members, you have never done it because of your child, your sister, your brother, your mother always told you you don't spend enough time with me. This is the time to focus on it because you're not going to get this again. So use this time to your advantage, not at your disadvantage. Yeah, I know some of you may say, I've done everything. There's nothing done. You've been secluded for the last month or so. Yes, you have been secluded for the last month or so, but I'm quite sure that you can find time to do things that you have never always wanted to do in your life within the limitation of COVID, at home or just for a walk outside and so on. You can think about it.
Yeah.
Okay, number two, limit news and radio listening. That's the trigger, isn't it?
Yes.
When our good the Tansiri comes on, or his ministers come on, that can be a trigger. Or your TV reporters every day, there are people reporting on that. That's a trigger. So again, you need to think about that, the limiting the news and radio listening, because that doesn't help.
Mm.
We're not
And
running away from it.
yeah, and also social media, Gurmit, because
Yeah.
everyone, it's globally connected. So
Hmm.
whatever happened in other countries, they make believe that even we will go through this, and a lot of negative. Yeah.
Absolutely,
Yeah.
absolutely. And social media doesn't help. We glued to Facebook,
Yes.
aren't we? And Twitter and so on.
Mm-hmm.
It doesn't help all the time. Focus on other things on Twitter. So connect with others through online apps. Uh, you know, Twitter doesn't just talk about COVID, does it? Facebook doesn't just talk about COVID, does it?
Yeah.
No, there's so many other things going on in the world that you can talk about. Old projects you want to talk about. Other things you can talk about. Focus on that.
Yeah.
Not only,
If you guys want to go for hike next year in Mount Kinabalu, okay, come text me.
yeah, there you go. You got a project from
Yeah.
Sangeeta. Okay. And the other thing is exercise. Go for a
Mhm.
short walk. You are allowed to do that once a day. All you need to do is you're following the rules, social distancing. I
Mm.
do it every day. When I get a chance. I mean, the weather is getting better now. It's not too bad here. I mean, today is about 8, 9, 10 degrees. Yes, last week was like 20 degrees. I go out for a walk almost every other day. because I need to do that. That makes me feel better. It's who I am. We are social animals as humans.
Mm.
We need to go out. That's why in the UK, the government never stopped people to go out completely, unlike China, and I think unlike Spain and Italy, they completely stopped people going out. It was that bad. But this,
Even in Malaysia, right?
yeah,
If you just take a stroll at your park and all that, if there's
yeah,
a police or anyone, they will
mm,
stop you and give you a summon.
yeah,
So yeah, so you find your ways how to do it, or maybe just go out, talk to your
yeah,
neighbors. It's
yeah.
time to know your neighbors.
Absolutely. Yeah, exactly. So be mindful of your social distancing. That's all,
Yeah.
that's all the government are asking you is just a little thing. Be mindful of it. Don't go near each other near 2 meters. Um, Yoga, housework chores, DIY projects you have at home. This is the time to do it. You won't get this time again. So focus on these activities that you haven't done before. So, and I think, oh, sorry, this is okay, and relaxing, mindfulness and music, and people have done this before. I'm sure that you all know how to do this. This is nothing home, and you can do this by yourself. Um, Self-care, looking after self with self-pampering activities at home. You can do things like you like at home. This is the time to pamper yourself. Those ladies, you always thought about having some time to polish your nails yourself. You want to, try some new makeup set, for example. Yeah.
Yeah.
So this is the time. I mean, Amazon hasn't stopped. The Amazon still delivers there. All the delivery is still happening, right? In
Mm,
Malaysia?
okay, I'm not a online purchaser or buyer, so I don't
Okay.
really purchase
Okay.
online. So
Yeah.
I'm
Okay.
not sure about that. But I
Yeah.
think if we look at Shopee or Lazada, they
Yeah.
still do, yeah. Yeah.
Right. Okay. So yeah. So there
Oh
you go.
yes,
So
it's
this is
ongoing. Amazon, yes, still ongoing. Thank you.
yeah.
Sylvie. Gurmeet, we have a question, yeah. Uh,
Yeah. Go on.
from Ku Yusuf. I'm doing telecounseling. All right.
Yeah. Uh-huh.
Only by phone. Question: do you think it's effective? I prefer online video counseling. What do you think?
Okay. I think so. This telecounseling and video counseling is a major thing. It's like 90% of all psychologists, um, all mental health practitioners, counselors, psychotherapists, everyone in the world is
Mm-hmm.
now doing this.
Yeah.
Okay, so we have found from previous research that video therapy and telephone counseling have been quite successful, and they are quite effective, just no nearly as same as face to face.
Mm.
They are quite effective, but there are ways to do it.
Yes.
So what's happening here is we all our organizations like British Psychological Society, the BABCP, now organizing some webinars similar to this one, and telling people what are the better ways of working. So what are the better ways of doing behavioral experiments? What are the good ways of telling people to do PTSD work? By video or teleconferencing. I attended one last week from with David Clark, Professor David Clark,
Yeah.
who's the person who done the IAP,
The person behind
he's,
I have, yeah.
yeah, so yeah, he's in Oxford University, so at the moment, and we all had one session with him last week, and which was very useful, how to do, and these are world experts I'm talking about here, on psychological therapy. Professor N.K. Ellis, who talked a lot about and social anxiety,
Mm-hmm.
and PTSD, and they were all on there from Oxford. They're all Oxford University, so they've talked about it. Quite useful way of doing it. But yes, your answer to that is you can do it. You need to be very mindful of find out about what the client is good at. When you do counseling, sorry, on online, on telephone, what are they good at? What do they want to do? What are their strengths in terms of when you do on the phone? Is there anything they can do in
Mm-hmm.
terms of strategies? You always check out with them. What are you doing now? Is there anything extra you think might be helpful to help you? Does that answer the question?
Yes, cool. Can I get a
Yeah.
thumbs up? Cool, Yusuf. Oh, cool. But I think what you mentioned is yes, it's like you don't get the whole feeling as with face-to-face counseling and all that, right?
Mhm.
But
Mhm.
you need to be more observant on
Yeah.
the tone, on their concern, and try to put in the skill that we have learned for so many years
Mhm.
into, not face to face. I think it
Yeah.
works because I tried a few, and yes, it works. And it all again depends on the client, the patient. Are they
Yeah.
willing to work on it?
Yeah.
Because
Yeah.
no matter how much effort we as the therapists we put in, but if the patient and the client not willing to accept and to grow, then the
Mhm.
best technique, the best skill will not work.
Yes, absolutely. So
Mm-hmm.
you got to think, yeah, I mean, there are a lot of webinars, if I have time and I would have taken you through some series of practicalities on working on this. I mean, unfortunately, time is quite limited, so we need
Yeah.
to focus on here. Right, right. Okay, does that make sense to everyone? I hope that everyone's got the idea of the slides that are presented, the techniques, the thinking strategies, the behavioral strategies that have given you some sort of input for you to work on.
Yeah. Can we
Yeah.
get a thumbs up if all okay? Like, yes. Thank you.
I can't see the thumbs up here, can I? All right.
You can. It's
Okay.
under, yeah, yeah. That.
Ah, okay. Yeah, yeah, yeah.
Yeah.
Okay. I
All
can
thumbs
see
up.
lots of people. Thumbs up.
Yes, yes. So,
Does anyone have any questions at all?
mhm.
Or?
So we have one. We have from Carmen. Is the slide provided after Zoom session?
The slide. Oh, okay. Those slide. Well, I can, I can naturally share a few of them. That's not a problem. That's fine. I mean, it's quite, the knowledge I'm talking about in the slides is nothing significant. They're all evidence based, and they are all in textbooks. If you look at worry book, you will find the worry tree in the textbook, which is quite a common strategy when you work people who has got worry problems. So there's nothing, I'm not telling you anything out of my own mind of something I've developed, but this old textbook is just the way you relate to it. You're using it differently. That's all.
Yeah, because the audience here today, they are public. They are not therapists. They are not counselors, psychiatrists.
Right.
Only a few of them. Yeah, I think
Yeah.
like Yusuf. I think he is a counselor.
Okay.
And myself, and I think the rest is just public who come into this platform to learn and to get the skill. Yeah.
Yeah.
Okay, I'm
So
using, yes, Gurmit.
yeah. So whatever what are, the slides mainly about cognitive behavior therapy, because that's what is endorsed by the National Institute of Clinical Excellence here. That's called NICE in short.
Mm-hmm.
And we do a lot of CBT here because that is the evidence base for anxiety and depression. We
Mm-hmm.
from lots of RCTs and meta-analysis work. And that's what we do mainly here. I mean, there are other modalities you can use, for example, counseling strategies that you learn as counselors, but you can also use, mindfulness-based cognitive therapy. You can also use acceptance and commitment therapy, ACT for short. But again, these are
Mm-hmm.
all branches of CBT, in other words, the third
Yeah.
generation of CBT.
Generation. Yeah.
Yeah, so you can use so many techniques out there. You can use compassionate focus therapy. Some of you must be a CFT followers. Professor Paul Gilbert, who is also here from the UK, he's
Mm-hmm.
currently has got lots of videos he's taken out how to use the compassionate focus therapy approach during COVID. So you can use that as well. I mean, there are lots of information. I mean, I'm getting a little bit overwhelmed
Overwhelmed. Yes. Yeah.
by using so many techniques I've got here.
Yes.
Which one I have to pick, which one I'm overloaded, which one should I use, so
Yeah.
so
Okay.
you got to think what's good. Yeah.
Yeah. So we have Lakshmi Kumar and Hajanis, counselor too. So you see the platform is there. And then we have Ki Pao. I'm a LPC counselor. Thank you so much. So the more we reach out, the more we get into, the platform, we learn more, right? So
Yes, right.
before we end the session, Gurmit, anything or any last questions you want to ask Dr. Gurmit? It's not easy to get him, It's like the time difference, and then he'll be busy. Then when he call back, I'll be busy, or I'll be sleeping, or he'll be sleeping. So
Yeah.
yes, any question while he's still, we have 5 minutes with him. Any question, please list it out. Gurmit, any
Yeah.
last words? Any last? How do you cope? Yeah, I know you have your coffee with you.
Yeah, that's gone cold. I need to go and top it up. Yeah. So how do I cope? I think I'm trying. I've got a few things. So I do a lot of running. So that's what my way of coping. I run in the park every other day when the weather is nice. It was raining all day yesterday. It's not today, so I might go for a run later. That's what I do. Sometimes I just watch a TV, Netflix. You have your own programs that you watch, you follow on. Guess what? I found. When I was little, I used to see Ultraman. People remember Ultraman?
Yes, yes.
Yeah. So those of you, yeah, so Ultraman was my favorite cartoon. So now Netflix has got the new Ultraman. So So I watched that. I just finished it last night. So that keeps me going. Yeah, it keeps me happy. It relates me to my childhood, happy childhood.
Yeah.
Yeah. So that's what I do, and I try to find other like Thundercats. Some of you might
My
say
favorite.
Thundercats.
Yeah.
Yeah. So all of these, I try to find them and I'll see them. That's how I cope. Things that makes me happy from the past, and things that outside. Here in the UK, we have a choice to go outside once, either for shopping or for running exercise 1 hour per day, and I use that, and I love doing it because it just connect me to the nature. Where I live at the moment, there's a lot of nature here, green and so on. So I use that. I love doing that. That's how I cope, and talk to my family sometimes when I get a chance to read books, not psychology books or anything, other important, lovely books,
different books. Yeah.
fiction and non-fiction stories and so on. So that's that. Find what you like from in the past. Try to reconnect with those things if you can, because this is the time you will not get this time again.
Yeah.
Because soon everyone's going to go back to work.
Yes. The new norm will become the old norm.
Correct. The new norm will come. Oh, number one thing is for sure that we now know that therapy could be delivered or can be delivered through webinars and so on. So which is again something will be a big debate. Think about this is a social experiment. The whole COVID thing, as psychologists, it's a social experiment that's being done throughout the world to see how people actually cope. It's unfortunate I don't have time. I would have loved to do a research at this point in time. How the mental health professionals are coping and so on. Just as what you said to me, and how are people working mental health, people's mental health professionals. How are they coping by looking at the screen 4 to 6 hours a day? Because remember, if you're doing therapy on screen or phone, your concentration is now changed, right? Your concentration on the screen more than usual. So how is that having an impact on you is very important. So people need to understand that, how is that having. So yeah, so if I have a think about that, I hope at some point I will come to Malaysia again.
You will. You know who will invite you again?
Yeah. You got Sangeeta there. She's after me all the time, and she's such a lovely, lady. And thank you very much, Sangeeta. It's been a pleasure to work with all of you, and I really hope to come back soon, to do some work, because there is some work Sangeeta and I was trying to have a look at. I think it got pushed away because of COVID, but we are going to certainly revisit this again as soon as COVID is over. Because I think the Malaysian government, particularly the health minister and so on, can do so much for the mental health part, just as our government is doing over here.
Yeah.
I do believe that mental health is such an important issue. The Malaysian government can do much more in terms to becoming a main sponsors of running all these clinics. Just as you run a physical health clinic, what is actually stopping you to run a mental health clinic? And everywhere throughout Malaysia, there's nothing stopping them. I think there has to be a project that needs to be done, that needs to be trialed out, and I think Sangeeta has been working very hard on that. Hopefully, we will come up to a point where we'll be able to come up with a plan where we will action that plan very soon.
Yes. So thank you so much, Gurmit, for your time. From all of us here, thank you so much. And yes, it is a wonderful session whenever you're with Gurmit.
Thank Thank you.
Yeah, if you need any information, you can email us info@ejAsia.net, or those of you who have my number, you can just WhatsApp me. If I don't reply, I'll reply later. Maybe I might be in the session or something. So thank you, Gurmit, so much for your time.
Yeah, thank you.
All
Thank
right.
you very much. Thank you, all. Yeah.
Yes, and tomorrow we have Dato Dr. Abdul Halim. He's the president of Perkama. All right, he will be on board tomorrow, 2 to 3, same time, and he's going to talk about isolation. So, I don't feel like letting go, but I have to let go.
Yes, that's right. No worries.
All right, take care.
Okay.
Thanks,
Take care of
Gurmit.
yourself.
Take care,
Thank you,
everyone.
everyone.
See you tomorrow.
All the best.
Bye-bye.
Take care. Bye-bye.
Bye-bye.
Bye.